Hello everyone, my name is Nicole Watson and I am presenting the drug Benazepril, or known as the brand name Lotensin. I'm going to go over the discovery, structure, clinical trials, pharmacodynamics, pharmacokinetics, and cool stuff about Benazepril. The discovery of the ACE inhibitors started with the creation of captopril. Captopril was the first ACE inhibitor and a great development in cardiovascular medicine. John Vane's research used Brazilian viper's venom peptides to inhibit the ACE activity from a dog's lungs. He won the Nobel Prize in 1982 for his research that helped create captopril. Captopril is rarely used today because there are better ACE inhibitors that are available for patients to use with the cocktail of drugs they may need to control their blood pressure or heart failure. Captopril helped pave the way for better ACE inhibitors to be discovered and introduced to the market for the treatment of hypertension and heart failure. Benazepril, or Lotensin, was patented in 1981 and was approved by the FDA in 1991. This is a picture of what Lotensin pills look like for 40 milligram tablets. In 2021, it was the 147th most common drug prescribed in the United States with more than 3 million prescriptions. Benazeprilat, a metabolite of benazepril, is a carboxy group of the 2-amino-4-phenylbutanic acid that is converted to an ethyl ester, and it is used as a prodrug for the ACE inhibitor. It is synthesized from benzocyclohexane, a synthetic source that goes through a Beckmann rearrangement to form the benzapine intermediate. And you can see the change from the benzocyclohexane to the benzapine Beckmann rearrangement, going from a 6-membered ring to a 7-membered ring on the screen. The synthesis of benazepine is less expensive and uses sodium azide, a non-environmental friendly compound. There is much more research needed to find a green chemical process that is more economical. Benazepril, or Lotensin, is a drug used to treat hypertension and heart failure, reduce renal disease, and prevent stroke, myocardial infarction or heart attack, and cardiac death. It is an ACE inhibitor drug. Angiotensin II is a vasoconstrictor that stimulates aldosterone secretion by the adrenal cortex, which causes more fluid in the body and blood vessels to constrict the blood flow in the body, raising blood pressure. With the ACE enzyme inhibited, blood pressure is reduced because the blood vessels are less constricted and there's less sodium retention, which results in less water retention. Benazeprilat inhibits the ACE enzyme in human subjects and animals. Here's the structure of Benazepril on the screen, and some special features that it has are 5 hydrogen bond acceptors, 2 hydrogen bond donors, 3 rings, and 10 rotatable bonds. It is an aromatic heteropolycyclic compound and has an ethyl ester. With this particular version of the structure that's showing on the screen, you can see the hydrogen bond acceptors in red and the hydrogen bond donors in blue. And it's a lot easier to see the differences in the two structures and the tube structure on the right compared to the wired structure on the left. When Novartis Pharmaceuticals did clinical trials, the trials were double masked, randomized for all sexes for ages between 18 to 80 years of age. The purpose of the trial is designed to study the efficacy of the amlodipine with benazepril treatment versus just benazepril treatment alone in the treatment of severe hypertension. It was a phase 4 study and it was interventional. The primary outcome goal was blood pressure less than 140/90 or less than 130/80 with subjects with diabetes. The goal was achieved better after 4 weeks with subjects on the amlodipine with Benazepril than just on Benazepril alone. The secondary outcome showed subjects achieved the goal of blood pressure less than 140/90 or 130/80 with diabetes after 6 weeks on the combination drugs versus the monotherapy alone. There was also a change in a baseline for sitting systolic and diastolic blood pressure, favoring amlodipine with Benazepril over just Benazepril. But unfortunately, there was swelling in arms and legs after 4 and 6 weeks for those on the amlodipine with Benazepril versus no swelling with subjects just on Benazepril. Lotensin has been evaluated for safety in over 6,000 patients in clinical trials, with 700 patients treated for 1 year. The reported side effects were generally mild, and there are no relation between side effects and age, duration of therapy, or total dosage within ranges of 2 milligrams to 80 milligrams. The side effects considered possible or probability related to the study drug that occurred in the United States placebo-controlled trials, and more than 1% of patients treated with Lotensin are shown below. I wanted to point out 2 interesting common side effects that both seem to have, which was headache and dizziness. I thought it was interesting that both Lotensin and the placebo have the same 2 top side effects. ACE catalyzes the conversion of angiotensin 1 to angiotensin 2. The red arrow indicates where the ACE enzyme converts angiotensin 1 to angiotensin 2. Benazepril, the ACE competitor inhibitor, acts as a prodrug when hydrolyzed to benazeprilat. The ACE inhibitor blocks the ACE enzyme inhibiting pathway, and that is shown right there with the blue arrow indicating where the Benazepril blocks the enzyme. Benazeprilat competes with the angiotensin 1 for binding at the ACE enzyme, blocking the conversion of angiotensin 1 to angiotensin 2. The structure of Benazeprilat is shown with the ester group cleaved with 8 hydrogen bond acceptors and a charge that would make a great salt bridge if fitted properly into the binding site. With ACE being inhibited, a decrease in angiotensin 2 results in lower blood pressure. Benazepril is an orally taken drug, and food slows the absorption rate of Benazepril. It follows Lipinski's rule of 5 with a molecular weight of 424.49. It has 5 hydrogen bond acceptors, 2 hydrogen bond donors, and a log P of 1.54. Its bioavailability is 37% and reaches peak plasma concentration anywhere between a half an hour to an hour and a half. Benazepril is 96.7 protein bound, and Benazeprilat is 95.3% protein bound. It is metabolized in the liver, the ester group is cleaved, and the intermediate Benazeprilat is formed. Benazeprilat is conjugated to glucuronic acid and is excreted through urine. The half-life of Benazepril is 2.7 to 8.5 hours, and the half-life of Benazeprilat is 2.3 to 9.2 hours. So the overall accumulation of the half-life of Benazepril is about 10 to 11 hours. It is an inhibitor of CYP452C19 and CYP453A4. It is not recommended for pregnancy use because it can cause complications or end the pregnancy. It can also cause neonatal death. Some signs of toxicity are severe hypotension, headache, dizziness, fatigue, nausea, and cough. You should avoid consuming foods with potassium containing products such as fresh fruit like bananas, strawberries, oranges, melons, fresh vegetables like avocados, tomatoes, spinach, and mushrooms can all increase the risk of hyperkalemia. Hyperkalemia occurs when potassium levels in blood are above 5.5 millimoles per liter. A potassium level above 6.5 millimoles per liter can cause heart problems that require immediate medical attention. You should also avoid taking subconatril due to the risk of angioedema or serious swelling. Also avoid angiotensin receptor blockers, calcium channel blockers, loop diuretics, potassium sparing diuretics, thiazide diuretics, pain drugs due to the risk of kidney disease, and supplements with potassium. All of these can have negative drug-to-drug interactions with each other. I chose this drug because this is the blood pressure medicine that my aunt takes, and I'm interested in learning more about it. It is a very affordable drug, with the average cost being about $4 depending on strength and pharmacy coupon. It is concerning, although, that Benazepril can block your kidneys from secreting potassium the way they normally would, which can cause a higher than normal amount of potassium to build up in your blood, causing potential heart problems. It's nice to know that there's medications on the market that can help lower blood pressure and help reduce the chance of heart attack or stroke, but unfortunately, the seesaw effect happens where you fix one problem but create another problem. These are the references I used for my presentation. Thank you for listening, and I hope you enjoyed it.